Today, I'm going to talk to you about implementing an ICU daily goals and plan of care checklist. We perform this at Huron Valley Sinai Hospital in Commerce Township, Michigan. This is our internal medicine residency quality improvement project of 2021. This QI project was performed by Eric Snowden, PGY3, Catherine Swords, PGY2, Erica St.Lawrence, PGY2, Murad Kalajian, PGY1, Jeffrey Lee, PGY1, Brett Owens, PGY1, and Dr. Amarjit Sethi. Now, let me give you a little background on this QI project. When working in the ICU, the care for critically ill patients depends on effective communication and collaboration of a large team of clinicians. Various tools are available to improve care processes in the ICU, including several checklists and principles of resource management. In Chart A, our results show there was a variance in the categories that were used throughout the 2-week period. Image A shows a partial daily goals checklist template. Chart B of our results shows that 83.3% of the participants would like to implement the daily goals checklist on a permanent basis. Chart C of our results showed that 66.7% of the participants either agreed or strongly agreed that the daily goals checklist helped them understand their patient's daily goals, with a perceived notion of better patient care. Our project consists of implementing a daily goals checklist to improve the management of critically ill patients at DMC Huron Valley. By improving interprofessional communication and practice, the daily goals checklist aims to enhance patient safety and daily progress, encouraging momentum in recovery from critical illness. Our primary objective of this study was to improve communication, patient care, and education. The study was conducted in a 10-bed closed medical surgical ICU. All patients were greater than 18 years old admitted to the ICU. Data was collected over a 2-week period of time. Our project design is a mixed method design with both qualitative and quantitative approaches. The 3 data collection methods included the following: field observations to evaluate how the daily goals checklist is utilized. Daily Goals Checklist, a paper-based tool addressing all concerns in documenting the care plan. Completed fields and items were documented and completion rates were calculated. And a participant questionnaire. It was sent out after the 2-week implementation to explore opinion/feedback on the Daily Goals Checklist. Potential plan intervention post-data collection included implementation of a Daily Goals Checklist into everyday practice as a quick, simple tool for morning ICU rounds with an impact on communication, patient care, and education. Our QI project was successful in determining which categories were most frequently reviewed on the daily checklist. It also provided thorough review of patient clinical status. It additionally improved communication regarding daily goals for each patient between the nurses, attendings, pharmacists, and residents. The most commonly used checklist category included tubes and drains. This monitored the presence of central lines, PICC lines, catheters, and drains. This could be attributed to the fact that catheter-associated bloodstream infections and UTIs are commonly complications and causes of increased ICU stay. Surprisingly, the ventilation category was the least observed in the daily goals checklist. This may be secondary to the checklist not addressing ventilation status. Per participant questionnaire, ICU staff noted that the checklist did improve communication, patient care, and education. In addition, 83.3% of the participants would want to implement a daily goals checklist on a permanent basis. There were some limitations to the study, including the compliance of the daily goal checklist. This was compounded by the recent uptick in COVID-19 patients during the pandemic. Some improvements that could be made on future QI projects with a ICU checklist would be shortening the amount of items on the checklist with the underutilized categories. Implementing it in the EMR would make it easier to complete for the staff, and it would provide better accessibility for them.